Good afternoon, and welcome to Facebook Live with Holy Cross Health. My name is Nancy Nagel, and I am the Vice President of Women's and Children's Services at Holy Cross Health. Before we begin, I'd like to call to your attention a few ground rules that you will see in the comments section. We encourage you to participate, but please keep any questions and comments general. We will not be discussing anyone's specific health situation in this public forum. For those of you joining us today on Facebook, we thank you for being here and for taking an active role in your health. And we at Holy Cross are happy to be your partner in this health journey. Today's topic is about improving women's health across the lifespan through preventative services and screenings. We're joined today by Dr. Elham Goyori, an internal medicine physician at Holy Cross Health Partners in Kensington, and Dr. Juliette Prust, the chair of obstetrics and gynecology at Holy Cross Hospital. Dr. Goyori is board certified by the American Board of Internal Medicine. She went to medical school at Tehran University of Medical Sciences and completed her residency at Mercy Health, Northeast Ohio Medical University in 2015, and since then has been serving the Montgomery County community. Dr. Prust is board certified in obstetrics and gynecology and was born and raised in Washington, D.C. After medical school, Dr. Prust returned to D.C. for residency and has been with Holy Cross ever since. When not taking care of patients, Dr. Prust can often be found on her Peloton and/or traveling. So today, we'll be taking a look at women's health care chronologically, from early adulthood through maturity, and discussing the services that Holy Cross provides for women across the health span. I'd like to start with early adulthood and Dr. Goyori. Doctor, as we focus on care in early adulthood, can you tell us why it's important for a young woman to establish a relationship with a primary care provider such as yourself?
Hi, everyone. The patients are usually being transferred from pediatrics office to my office at the age of 18. And it's important to be established with a physician in adult care for various reasons. For example, if there are any vaccinations that are missing, we can do it in our office. One of the most important one for ages of 11 to 12 is the HPV vaccine. If that's not done in the pediatrics office, we can go ahead and do it in our office. As you know, HPV is a vaccine HPV is a virus that is the cause of cervical cancer. Also, I ask my younger patients if they want to be tested for STDs, and if they think they're high risk or they just want to be tested, I can go ahead and do the testings for them.
Thank you, doctor. That did touch on some of the vaccinations. Are there other screenings that you recommend for young women?
Also, we want the patients to be tested for hyperlipidemia between the ages of 17 and 21. Of course, if the patient has some risk factors, we want the testing to be more frequently. And again, we want the patient to be tested for hypertension with every visit to my office.
And tagging along on that, doctor, can you talk a little bit about the importance of healthy habits, starting them and forming them from a young age, and working with you as a primary care provider to just set up for success in life, in health?
Well, I usually do some counseling regarding the exercise. The exercise needs to be done of 30 minutes of walking or jogging 5 days a week, and that's the minimum. If somebody wants to do more, they're more than welcome, but that's the minimum recommendation. Also, for their diet, they want to consume 2.5 cups of vegetables and 2 cups of fruit daily.
Excellent. And we know that you are a physician with Holy Cross Health Partners. How can patients help find, if they wanted to come to you and your practice for care, how can they find you or make an appointment?
Well, they just can easily call our office to make an appointment, or they can go to my page in the Holy Cross website. There is a link called In Quicker, and they can make their appointments online.
All right, very good. I'm going to turn now over to OB and Dr. Pruss for several questions. As we know, OB involves the care of the woman both before, during, and after pregnancy, and is one of our major service lines here at Holy Cross. Dr. Pruss, can you tell us, we know that Holy Cross delivers a lot of babies. Are we the largest in the state?
We are. So we are the largest in the state and top 10 in the country in terms of deliveries. We take care of all types of pregnant women, low risk, high risk, insured, uninsured. Holy Cross is unique in that we have both a clinic that serves the underserved population. There are also a variety of different private groups that also deliver at Holy Cross.
Very good. And do we have a high risk perinatal center at Holy Cross for high risk patients?
So we do. So the high risk perinatal center, so it encompasses 2 divisions. So both the inpatient division, which cares for our patients that are high risk that need to be hospitalized for at least a portion of their pregnancy. We also have the high risk, we also have the perinatal diagnostic center that serves to perform ultrasound testing and antenatal fetal monitoring during the pregnancy for both our patients that come to the clinic or for the underserved population, as well as for our patients that come through triage that need to be evaluated.
And similar to the same question I asked of Dr. Gregori, when should women start looking for an OB, and what should they be looking for in a provider?
So, often women have already established care before they get pregnant, because similar to establishing care with a primary care doctor after they turn 18, a lot of women have also established care with the gynecologist. And most gynecologists also do obstetrical care. And so we often also take care of women from pediatric age through menopause. But if they haven't already established care, then I usually tell people that they should start looking for a doctor when they are considering getting pregnant. There's a lot of counseling that goes into the pre-pregnancy visit in terms of making sure that their health is optimized, talking about prenatal vitamins and other supplementation, and then healthy lifestyle and diet modifications that we usually discuss prior to pregnancy. In terms of what to look for in an obstetrician, so first, when you're looking at a specific group, some people prefer a solo practitioner where they know that they're always going to have care with one provider. Some people, which is pretty rare these days, but other people want to find a medium-sized group. Some people might prefer a female-only group. And then also, look at what hospital they're delivering at. So most groups will deliver only at 1 or 2 hospitals. And so, you want to make sure that it's both convenient to your to where you live, and also is in line with where you want to deliver. In terms of philosophies that you might want to discuss with your OB, what kind of antenatal testing do they have in their office? So can they do ultrasounds in their office? Can they do lab work in their office? What is their philosophy in terms of delivering? Do they have good access to maternal fetal medicine, and do they have good relationships with endocrinology and things like that? So hopefully you don't need any of those other services, but you want to make sure that they have a good network of associate providers. In terms of the hospital, there are a ton of labor and deliveries in the area. There are a variety of differences between the labor and deliveries. So things to think about for labor and delivery are, do they have, how big is their labor and delivery unit? Do they take care of high-risk patients? Do they have, again, hopefully you never need any of this, but do they have an ICU that is capable of taking care of a high-risk obstetric patients? And then the NICU is honestly one of the most important things. So here at Holy Cross, we have the highest level NICU outside of children's. And so our neonatologists are very well versed in taking care of even the smallest babies. And they can do almost anything at Holy Cross and don't need to transfer out, with the exception of fetal surgery and a few other highly specialized treatments. But that is one of the benefits of Holy Cross, is that we are very specialized in treating the high-risk patient, and that you get to be, we don't very rarely have to send a baby out, so you don't get separated.
Thank you, Dr. Prust. And again, I know that you would reinforce for everyone the importance of prenatal care.
Yes. So, most women, they're young, they're healthy when they get pregnant. And so it might seem like illogical that you have to continue to see your doctor throughout pregnancy. At the beginning of pregnancy, it's usually once a month. Towards the end of pregnancy, it's every week. The reason that happens is that even the most low-risk person can become high risk very quickly. Gestational diabetes, high blood pressure, preeclampsia, thyroid disease are some of the most common things that we take care of. And a lot of those things can develop asymptomatically, meaning that you don't have any symptoms and we just find it on routine testing, or it can develop very quickly. So it's important to follow up per your doctor's instructions periodically throughout the pregnancy.
And Dr. Prust, knowing that within Holy Cross Health, our system, we have both Holy Cross Hospital here in Silver Spring, and as you've pointed out, large labor and delivery, largest NICU, level 3 perinatal referral center. We also have Holy Cross Germantown Hospital, so that women that live up county still can be part of the system. Is there anything else before we move back into middle age that you think makes the program here for obstetrics so special?
So I think one of the things that makes it so special is that, we have a large team of dedicated personnel. A lot of our nurses have been doing this for a long time. A lot of the physicians have also been here for a long time. And so it's a group of really dedicated people. We've also can take care of almost all complications of pregnancy. So we're very well versed in that. And even if let's say you go and you're planning on delivering at Holy Cross Germantown, while their NICU is not as advanced as the one in Silver Spring, we can easily transfer, and it's within the hospital system, so we can do that seamlessly. There are also a lot of other services. So let's say if unfortunately your pregnancy, there's some issues with the baby where they don't necessarily think that they're going to be able to survive, or there's just a lot of issues. We have a great social work team, and we also have a program called Never Alone, so that patients develop a coping system and also have the support that they need, both mentally, physically, and spiritually, both during their pregnancy and after their pregnancy.
Thank you. Thank you so much, Dr. Prust. And as we move from obstetrics now into middle age, and I'm going to go back over to Dr. Gowri, as we move through the lifespan and we start to approach middle age, can you just discuss with us just some of the tests and exams that a woman will need as she does get older?
Sure. First of all, regarding the pap smear, we normally recommend against doing pap smears before the age of 21 because cervical cancer is very rare at that age. However, between the ages of 21 to 30, we start doing pap smears, and then we combine it with HPV testing to find the HPV 16 and 18 that are considered high risk for cervical cancer. If there is any abnormality on the pap smear, then I can do referrals to the OBGYN for further diagnostics and treatments. Regarding the mammogram, we normally start doing mammograms at the age of 40. Mammograms needs to be done every 1 to 2 years, and if everything is normal, we just continue doing so. Sometimes the radiology doctors want you to go back to do a diagnostic mammogram. It means that they have seen something abnormal on your mammogram, but they're not sure. So they want to do a magnified X-ray on that specific area. And usually they combine it with an ultrasound. So please, if you receive a phone call from me or from the radiologist to go back again for a diagnostic, just do not freak out. It doesn't happen all the time, but it's not unusual either. And oftentimes, the result of the diagnostic mammogram and the ultrasound comes back normal. And in rare occasions, then they need to do a biopsy. Regarding the ovarian cancer, we normally don't do any screenings for ovarian cancer unless if a patient is high risk, like a very strong family history of ovarian cancer. And finally, we do a PHQ-9 screening test in our office. That's a test for depression. It's just a questionnaire, and you ask the questions, and it gives me a score between 0 and 27, which 0 means that no depression, and 27 is severe depression. Sometimes in milder cases, I start the patient on medication, but if I don't feel comfortable and I think the patient is a complex patient with more severe depression, I do referrals to the psychiatrist.
And doctor, before we leave middle age, can you discuss colonoscopy screening?
Sure. We used to start this screening colonoscopy for everybody at the age of 50. That's for a patient with no family history of colon cancer. If a patient has a family history of colon cancer in a first-degree relative, that's a totally different game. But we start doing colonoscopies at the age of 45 nowadays, and it has to be done every 10 years if the patient has normal colonoscopy. However, if the GI doctor removes some polyps based on the number of the polyps, based on the size of the polyps and the pathology, they might ask you to go back either in 3 years, 5 years, or 10 years. There is also a substitute test for that, which is the stool test for blood. So we do a sample of your stool and we send it to DAP to tell me if you have any blood in the stool or not. If that test comes back positive, then you have to go through a screening colonoscopy. And if that test is negative, you're going to be good for 1 year and the test needs to be done next year.
This has been very helpful because I think some of the questions, and I'm sure both of you get this in the office, that guidelines seem to change now and then. And I think that's, I know we hear that sometimes just on the front lines in the hospital, that it can be confusing about when to get these tests. So this information has been most helpful. And I think for our listening audience is, when in doubt, turn to your OBGYN, turn to your primary care provider to get answers if you're confused at all. So thank you. Now, as we move on, we're going to go to menopause. And Dr. Press, I'm going to come back to you because really we can't be talking about women's health without talking about menopause. So tell us about it. What is it? When does it start? How long does it last?
So, I mean, menopause is, the definition is truly no period for 1 year. The average age of menopause is 51. Now, many women, you know, when we think about the menopause, yes, the no period thing comes up, but women also think about hot flashes, night sweats, vaginal dryness, which are all symptoms of menopause. Sometimes those symptoms can start before the period has stopped. Some, you know, but every woman is different. So I usually tell people when they come to me in their 40s saying like, when's it going to happen? The answer is, I don't know, you know. And so one helpful trick is to ask your mom if she didn't have a hysterectomy or anything, like, how old were they, or if somebody has an older sister. A lot of times in the family, it can kind of run a similar course. So if, you know, your mom had menopause in her mid to late 50s, then that might be what you might expect. It's not a hard and fast rule, but that's one of the ways to kind of know when it might come. But it can happen in your 40s as well. So we think about premature menopause as being anything before the age of 40. But when we talk about menopause, you know, everything that we do for menopause is to treat the symptoms. There's no medication that somebody must take in terms of the treatment of medications, and we tailor it to each person. Like I said, some people can just wake up one day, never have a period again, never have a hot flash, never have a night sweat. It's rare, but it does happen. And then there's other women who will have a slow change in their period over the course of a few years. and will also develop hot flashes and night sweats. For some women, that lasts 1 to 2 years. For other women, the hot flashes can last for up to a decade. For those women, we treat the symptoms. There are both hormonal and non-hormonal medications that we use to treat hot flashes, night sweats, and vaginal dryness. There have been a lot of efforts made over the last several years to increase the arsenal of medicines that we can give to women for the treatment of their symptoms. It used to be that back in the day, we could just give hormone replacement therapy. And while hormone replacement therapy gets a bad rap, it definitely has its role in the world. But for women who either have contraindications to hormone replacement therapy, either uncontrolled high blood pressure, morbid obesity, high cholesterol, these are all women that we might not want to put on hormones. There are other medications out there that we can treat. And I usually approach it, patient to physician, talk about what they find the most bothersome, what their goals of care are, and then tailor it to that individual.
Thank you. Thank you, Dr. Prust. And then as we move from menopause into the next journey across the lifespan, talking about some of our most senior patients, which we often refer to as geriatrics, I'm going to turn back to Dr. Gayori just to share with us, if you can, just your thoughts on managing polypharmacy, dementia, and chronic disease management.
Sure. Just before I forget, speaking of colonoscopy, we want to stop doing colonoscopies at the age of 75 to 80. Usually because as we age, there is a higher risk of bowel perforation with colonoscopies because of the bowel fragility. So we want to stop at that age, and we can switch to the stool testing or just do not do any testing after the age of 80. Regarding dementia, I usually try to do a testing for dementia in my office. That's called a mini-mental test. It's just like a questionnaire. We can do it in 10 minutes in the office, and it detects early dementia. It's very critical to capture the dementia very early because the damage that's done by Alzheimer's disease cannot be reversed. So we have to start the patient as soon as possible on medications to prevent the patient from getting worse. And there are not a lot of medications. There are just a couple of them, and we can use it as soon as possible if we screen the patient for dementia. Polypharmacy is something that a doctor needs to be aware of for geriatric patients, because you don't want the patient to end up with a big list of medications that they don't actually need or they don't actually use. So with every single visit with my geriatric patients, I do a medical reconciliation, making sure that they actually need the medicine that they're taking, and I just get rid of the ones that they don't need to avoid polypharmacy in older patients.
That's so very helpful, because I know, again, just even as a nurse, and I am a nurse, one thing that patients will say after they've left the hospital or had surgery is, oh my gosh, I'm on a list of all these meds, do I take them all? And I always refer them exactly back to their doc and let them know that we do a med rec. So very helpful.
Yep.
Any other comments on just managing chronic diseases as you get into the senior years?
As we age, we all know that we are prone for hyperlipidemia. We are prone to get high blood pressure, diabetes, and hypothyroidism. We do screenings for that, and I try my younger patients to be at goal for LDL level of 70 to 100, A1C of less than 6.5, and blood pressure of less than 140/90. As we age, we can do it a little bit looser, so we don't have to do a very tight control, but still I want their numbers to be around the same that I mentioned.
And I'm keeping an eye on the clock as we go along here. And I want to give both of you an opportunity just for any final comments or advice to our listeners before we wrap up. And I'll start with, just go right back to Dr. Gayori again. Any words of wisdom?
Just do not miss to do your wellness visits. It's important and it's helpful.
Very good. Thank you. And Dr. Prust?
I would say the same thing, making sure that you establish care even when you're young and healthy. It's important because there might be things that you miss or you don't know. Not many things are asymptomatic. And, a lot of times women use OBGYNs as primary care and vice versa. And I think for the most part, that is fine as long as you have an OBGYN that's comfortable doing the basics of primary care, and then a primary care that's comfortable doing the basics of OBGYN. But certainly when you are trying to address specific issues pertaining to health, fields of health that are not with that specialty. So for instance, high blood pressure for me, you want to make sure that you're seeing the correct person. You want to make sure that it might be inconvenient to see multiple doctors, but you're really doing yourself a disservice. But healthcare, routine healthcare throughout your lifespan is important. And making sure, just trying to keep you as healthy for as long as possible.
Well said, and great advice from both of you. And I do want to take this opportunity to thank both of you. Just the wisdom that you've shared with us today, plus just I can tell you, just so both easy to speak with, etc. Our patients are lucky to have you as resources, very much so. So thank you. So I'm not seeing any questions in our chat box. So as we are, I want to try to stay true to our time. I know both of our physicians are managing busy practices and have to get back to patients. So as we're just about out of time, we do want to thank everybody for tuning in today. Again, to thank both of our physician speakers. If there was a question that we did not get to today, I would encourage everyone, you can go for additional information through Holy Cross Health's blog, or we can connect you with a physician, whatever the resources needed, either via our phone site or our website. Our website to learn about OBGYN is www.holycrosshealth.org/women's health. And anyone that wants to learn more about our Holy Cross Health Partners Primary Care, it's www.holycrosshealth.org/HCHP. So on behalf of all of us here today, we thank you again. We hope that you have found this informative and useful. We look to be your healthcare partners for life, and we hope to see you again soon. So thank you, and wish everybody a good afternoon.
Thank you so much. Bye.
Thank you.